Hello, I am Irene Boone Phillips. I am with Franciscan Health, and I am the program coordinator for the Lake County Community Tobacco Prevention and Cessation Coalition. We are providing this overview of the new Indiana Tobacco 21 legislation as it will impact some school policies, some local policies, and the practices and policies of the retail environment. This presentation is an overview and community education tool for the implementation of the new T21 legislation. Highlights include why the legislation was passed, what is happening in terms of youth tobacco use in the community, and a description of what's in the new legislation and how it compares to the federal law that was signed in December 2019. Several similar laws have been passed around the country, and some early data on effectiveness and smoking rates have already been seen. We will conclude today's session with information on Indiana's resources to help with the implementation of the new law, as well as tobacco cessation resources. After the federal T21 law was signed and went into effect in late 2019, the Indiana General Assembly passed legislation of its own. The law became effective just a few months ago on July 1st. This new law encompasses all tobacco products, including non-combustible tobacco products. E-cigarette devices and e-liquid was specifically added to previous legislation. One of the most key points is that this is part of a broader national effort in public health to reduce access to tobacco products by adolescents when they are at higher risk of addiction to nicotine. Because of developing brain addiction centers in adolescents, data has shown that later age of initiation results in fewer people being addicted to nicotine later in life. This is a chronologic listing of T21 legislation across the country. In 2005, Needham, Massachusetts became the first locality to pass such legislation, followed by statewide laws, and then finally the federal mandate in December of 2019. Before the mandate went into effect, 19 states, along with Washington, D.C. and Guam, had legislation in place, but not necessarily in effect yet. Indiana and Kentucky passed legislation after the federal mandate went into effect. This graph shows increasing youth tobacco use prevalence over time as measured by the National Youth Tobacco Survey. E-cigarette use drove an increase in overall tobacco use prevalence among middle school, which is indicated by the blue lines, and high school students, indicated by the black lines. Prior to 2017, there had been significant reduction in teen tobacco use initiation, but now e-cigarettes are becoming more prevalent, with disposable e-cigarettes contributing to increases in tobacco use among youth. These graphs show earlier initiation with a higher percentage of younger children reporting use in e-cigarettes without change in cigarettes in the same period. This indicates that e-cigarettes are the usual starter product, but data has shown that adolescents who use e-cigarettes are more likely to smoke conventional cigarettes later on, which is seen in the second graph. 1 in 20 middle schoolers now report using a tobacco product. In Indiana, the most commonly used products among youth in 2018 were e-cigarettes, followed by cigars, including cigarillas and little cigars, cigarettes, and smokeless tobacco, which is chewing tobacco, snuff, and dip. A somewhat smaller proportion of students reported using hookah or other tobacco products such as pipe tobacco, snus, or dissolvable tobacco. Here we have every use of combustible and non-combustible tobacco trends. As you recall, tobacco products can be categorized into two broad classes, combustible and non-combustible. Combustible tobacco products involve burning tobacco to produce a smoke that users inhale. Non-combustible tobacco products do not involve burning tobacco. They include smokeless tobacco products that users hold in their mouths and then spit out, as well as emerging products that do not involve burning tobacco, such as e-cigarettes, which heat a liquid to produce an aerosol that users inhale. While combustible tobacco products continue to cause most tobacco-related disease and death in the United States, non-combustible tobacco products, such as smokeless tobacco, also pose health risks, including cancer and nicotine addiction. In addition, although the long-term health impact of the use of electronic nicotine delivery systems, referred to as ENDS, remains uncertain, nicotine use can have adverse effects on adolescent brain development. Tobacco use by youth in any form, whether combustible or non-combustible, is therefore unsafe. Now, among high school students, every use of combustible tobacco products declined significantly between 2012 and 2018. While there was a decline in every use of combustible tobacco products among middle school students, it was not significant. Among middle school students, every use of combustible tobacco fell from 15.9% in 2012 to 12.7% in 2018. Among high school students, every use of combustible tobacco fell from 42.7% in 2012 to 29% in 2018. In contrast, the prevalence of every use of non-combustible tobacco has increased significantly since 2012 among both middle and high school students. While every use of non-combustible tobacco decreased from 2014 to 2016 among both middle and high school students, there was a significant increase in 2018 compared to 2016 as well as 2012. This increase was significant among both high school and middle school students and was driven primarily by a substantial increase in use of e-cigarettes between 2016 and 2018. As a side note, the Indiana Youth Tobacco Surveys are the most comprehensive local data collection on tobacco use among middle and high school students. Data is collected every 2 years, and this fall of 2020 is the next scheduled data collection. We certainly do hope to have those results to share with you in early 2021. Data has shown that a younger age of tobacco use initiation predicts future use of not only tobacco products, but also illicit substances and alcohol later on in life. In theory, this is because the adolescent brain has not yet finished development and is more prone to addictive processes, and nicotine in tobacco and e-cigarette products activates those centers. This is a side-by-side comparison of the Indiana legislation with the federal law. It's important to know that the federal legislation is tied to penalties through the Saynar Amendment, and there will be more on that later, rather than penalties for underage use. This will be tracked on the retailer side. The Indiana legislation officially increases the minimum age of sale to 21, similar to alcohol. And it also includes all combustible and non-combustible tobacco products, as well as penalizing possession and use, except in the course of employment or other necessary possession. It requires fairly significant changes to the required signs posted in retail areas for these products, and including where tobacco vending machines are present. Indiana law goes beyond the federal legislation by introducing penalties for possession, use, and purchase of these products while underage. It also requires retailers to check identification for customers who appear to be up to the age of 30, and this is an increase from 27 in prior legislation, and it limits the allowed locations for retail shops that sell tobacco and e-cigarette products. It is important to realize that the federal mandate does not prevent states and localities from passing more restrictive legislation. However, Indiana's youth access law does include preemption language which prohibits localities from passing stricter or looser legislation than the state level. After a recent outbreak in electronic vaping-associated lung injury, which is referred to as EVALI, Indiana's law goes beyond the federal government's legislation by banning the use of vitamin E acetate in e-cigarette liquid. There have been associations to cannabis products that included this ingredient in reported cases of EVALI. All age groups have been affected by EVALI, and it was a major public health crisis in the fall of 2019. During the current COVID-19 pandemic, the concern for EVALI and complications is still heightened. Indiana's law will be enforced on the retailer side by the Alcohol and Tobacco Commission, ATC, who will monitor retail stores to underage customer or retailer sales to underage customers. There will also be enforcement of the possession, use, and purchase, which falls under the PUP legislation, by local law enforcement. On the federal side, FDA has jurisdiction over these products and has been involved in the enforcement. This slide outlines individual and business penalties to Indiana's law. Notably, it is a Class C misdemeanor in the Indiana law for underage possession, use, or purchase of any tobacco or related product, and that again falls under the PUP legislation. The federal law focuses on the retailers who are distributing and selling these products to teens and does not include monetary penalties. Indiana's law increases penalties on retail entities by doubling the fines from previous legislation for each level of citations and increases the look-back period to the last year instead of being based on the last 6 months. It is a Class B misdemeanor if a retail entity has been found to sell to underage customers 6 or more times in the last year. Now, there are some exemptions. The Indiana law stipulates that possession in the course of business, agriculture, or retail is permitted. Otherwise, there are no exempt groups. However, in some states, people under 21 who are in the military are exempted. T21 has been recommended by public health advocates for more than a decade. This is because T21 has recognized benefits for population health in terms of reducing the long-term adverse effects of tobacco and nicotine use. By reducing the number of years and the number of people who use tobacco, health outcomes including chronic diseases like cardiovascular disease, cancer, COPD, and diabetes can be improved. In 2015, the Institute of Medicine, which is now the Health and Medicine Division of the National Academies of Sciences and Engineering and Medicine, released a report containing compelling evidence of the significant public health benefits of raising the minimum legal sale age for tobacco products. And that report concluded that raising the age to 21 would result in a 12% decrease in tobacco use, approximately 223,000 fewer premature deaths, 50,000 fewer deaths from lung cancer, and 4.2 million fewer years of life loss for those born between the years of 2000 and 2019. These policies are also good on population health level by decreasing non-smokers' exposure to secondhand smoke and third-hand smoke, and the chemicals that are found both in combustible tobacco and electronic cigarettes. Just to be clear, secondhand smoke is the environmental smoke or vapor that is released by a person who is actively using. Third-hand smoke is the toxic residue found on surfaces that may come into contact even after the activity has stopped. Surfaces such as tabletops, furniture, handles, electronic facings, and carpets. Similar age restrictions have been shown to be effective on long-term use of other things such as alcohol. Maybe most importantly, by reducing tobacco and nicotine exposure, we can improve perinatal outcomes as use during pregnancy is known to increase risk of premature delivery and results in growth-restricted babies who may have trouble gaining weight even after birth. Kids would then also potentially be exposed to less secondhand smoke and e-cigarette aerosol during childhood, reducing rates of environmental allergies, asthma, and other chronic conditions. Let's take a look at a few news reports.
We're looking at the impact of a new law Congress passed that raises the legal smoking age from 18 to 21. The new rule would be nationwide, covering more than half of states that have yet to increase the smoking age. It would take about 9 months to go into effect, but how effective it might be at reducing smoking rates depends on how fast and strictly it's enforced.
What we've learned is that kids are smart. Unless you get enforcement levels, compliance levels up to roughly 90%, it does not have a significant impact on overall tobacco use.
The president of Campaign for Tobacco-Free Kids sees the new law as a positive step, but he says it doesn't do anything to reverse the current youth e-cigarette epidemic. The campaign says more than 5 million kids 18 and under are using e-cig products.
Unless you eliminate those flavored products, mango, mint, menthol, kids will find a way to get them. So the key here is it's necessary to pair the increase in age with a ban on flavored products.
The federal government hasn't banned flavored e-cigarette products yet. Some states have, though. A few years after Oregon changed its smoking age to 21, they found about 10% fewer teens and about 5% fewer young adults started smoking or vaping. Almost all adult smokers had their first cigarette before turning 21, according to the American Lung Association. Past research found the law change could save an estimated 223,000 young people's lives.
Just recently, Chicago banned the sale of flavored vaping products, citing how these products are designed to entice youth. This is an article that implicates the evidence on the correlation between raising the age to purchase and possess tobacco products with reduction in teen vaping. This article is based on the recent results from the National Youth Tobacco Surveys. The decline is encouraging. We do want to make sure to pay close attention to the increase in the use of disposable products and the frequency of that use by current teen users. T21 and SINAR. The SINAR Amendment was passed in 1992, requiring states to have and enforce the sale of tobacco to those under 18. In 1997, SAMHSA stepped in and started the annual SINAR report that documents this enforcement, as well as required states to have a retailer violation rate no higher than 20%, or they would lose 40% of their block grant funding. The Substance Abuse Prevention and Treatment Block Grant for Indiana is currently about $16 million per fiscal year to help provide Hoosiers with treatment options for substance use and mental health disorders. These funds are also utilized to support and provide substance use prevention and mental health promotion programs to Hoosiers. This graph shows the retailer violation rates over the years. The dotted line indicates the average number of inspections done per month for that year. As you can see, the better enforcement efforts are, the more compliant the retailers are. The Tobacco 21 law will also help with this rate as more and more retailers update their policies and practices to reflect the new law. This will help keep those older high school students from being able to purchase products to share with underage friends and classmates. As we will discuss In the next few slides, you will see how the usage rates of middle and high school students drops in states that have implemented such policies. This chart shows the states that adopted legislation prior to the federal mandate in December 2019. Utah and Pennsylvania had passed legislation, but it had not yet gone into effect at the time of the mandate. Indiana and Kentucky both passed legislation this year, and those legislations became effective July 1st. The gray states in the picture are now under the increased enforcement of the SINAR program and have a minimum legal sell age of 21. This graph shows the chronologic view of which states passed legislation prior to the federal mandate. Blue states are those that passed T21 legislation prior to the federal mandate in 2019. Gray states are those who are now under the increased enforcement of the SINAR amendment. Prior to the federal increase, 19 states had raised the tobacco age to 21, along with Washington, D.C., and at least 540 localities covering over half of the US population. Looking at early data after adoption of T21 in various communities, there have been some overall mixed results. In the initial example of Needham, Massachusetts, high school smoking rates were found to fall more steeply in the local community than in surrounding areas, from 13% to 7% in Needham and from 15% to 12% in surrounding areas. This prompted more communities around Massachusetts to adopt similar legislation. Although California wasn't the first state with such a program, it published data that continues to evolve after starting this program. They were found to have a high level of awareness by retailers and follow-up surveys and showed decreased rates of sale to underage customers. Interestingly, results showed that there was geographic variation, with the San Francisco Bay Area having overall more success than Southern California. There are also other regulations issued around the same time as T21, including increased tobacco taxes, and that may have caused some confounding of the data. In Oregon, they adopted statewide T21 legislation in 2018. They found overall improvement in smoking rates, including in those aged 18 to 20 years. And in survey data, they showed that underage customers reported it wasn't easy to obtain tobacco products. Again, there were geographic variability, but this was thought to be due to more to enforcement. In New York City, the data isn't as convincing, but it is thought that there were some problems in the implementation, including lax enforcement and patchwork regulations, which allowed underage customers to go to other locations where they were still able to purchase these devices. Use rates remained stable after the New York rollout. Now, this is a discussion of those services that are available, and Indiana has 2 free resources available to all Indiana residents. The Indiana Tobacco Quit Line is a free and largely telephonic counseling service that helps Indiana tobacco users quit their addiction to tobacco. Currently, enrollees have additional options for how their services will be managed with counselors between phone, web, and text services. This is Quitting is the Truth Initiative's text messaging program designed for youth and young adults addicted to e-cigarettes. Indiana has a unique opt-in code, which is text Indiana to 88709. Vape-Free Indiana was created to implement prevention, public education, and cessation strategies to address youth e-cigarette use. Resources on the Vape-Free Indiana website may be useful for helping tobacco users 18 to 20 years old, parents, educators, and other stakeholders, including employers. Cessation resources are available through the Franciscan Aspire program. And we all know that it takes several attempts and a combination of methods for someone to successfully become tobacco or vape free. In-person and virtual tobacco recovery classes are very helpful, and they are available for a small fee through the Franciscan Health Aspire program. Anyone interested in group or individual counseling should call 219-865-3612 and ask for extension 1 or extension 2 for more information on meeting times and options that are available. These resources are available and they are designed for retailers, and they include warning signs for tobacco point of sale as well as frequently asked questions documents. They are available on the Division of Mental Health and Addiction website, which we know as DMHA. Indiana has several resources to help with the implementation of the new legislation, including the involved government entities, local tobacco control coalitions, prevention partners funded by DMHA, and local coordinating councils supported by the Indiana Criminal Justice Institute, which is CJI. If you are looking for tobacco retail specific information for your area, check out the DMH mapping tool that houses both FDA and ATC underage tobacco sale inspection data. Indiana Division of Mental Health and Addiction funds organizations to provide prevention programming. DMH also works with regional prevention coordinators who can assist with making connections to resources in every region of the state. And those coordinators can be located on the DMHA website. The following agencies have resources to help support the implementation of Indiana's Tobacco 21 law, and these are our state agencies. Please reach out to any of them for any additional information. Lake County is blessed with 2 tobacco control coalitions, the Community Coalition and the Minority Coalition. We are here as your local resource for student prevention initiatives, youth education, engagement and empowerment, public health education, provider resources, and policy advocacy. Tobacco use remains the single most preventable cause of death and disease. Health equity and public health is the opportunity for everyone to reach their full health potential. You could be a part of our mission to be responsive to the needs of our communities by participating in the Tobacco Prevention's Health Equity Task Force. We are all stakeholders in this, and it's through strong community partnerships of all sectors that we will eliminate tobacco-related and other health disparities and achieve health equity for all. You can forward any questions or requests for additional information or presentations to me at irene.boone-phillips@franciscanalliance.org, and I thank you.